Thanks, John, and thanks, David, for those comments, and Annie for your presentation on the report. I mean, what David was referring to is actually an HPN, the Practice Network Humanitarian Exchange, which we just published on the crisis in Syria. And I feel I'm here under false pretenses, really, because I've actually never been to Syria and couldn't claim to be an expert on Syria or any of the countries in the region. But through the process of commissioning this publication, and we also held a public event, which some of you may have seen a couple of weeks ago. It's become very clear to me that the issues around this crisis are things that the humanitarian community really does need to grapple with. I mean, I think there are a lot of agencies doing some very good work there under very difficult circumstances, and that's certainly reflected in this issue of the exchange. But as David said, the reality, I think, within Syria itself, from what I understand, is that a lot less is happening than we probably think. Most of that is due to local actors like the Syrian Arab Red Crescent and other local actors. The international agencies are doing very good work and working with some of those, but we may actually have the balance wrong. I think in the event that we held, Ben Parker, who is the former head of OCHA in Damascus, he actually said, in the context of Syria, actually, is it the amateurs who are having greater access than professionals? Are they being more effective in some cases? These are questions that we need to ask ourselves. And if that is the case, or if it is the case that in many cases in these besieged areas, it's local people helping other local people, how can we help that? How can we support that initiative? And I think that's what everybody is grappling with. And that isn't a call to scrap the efforts towards professionalizing humanitarian action, but it's something that sometimes we have to get the balance right. We get caught up in our own rhetoric around accountability and professionalization sometimes. I think we need to also look at what is the reality on the ground, what can we actually do, and what are our priorities in these particular contexts. And I think those are some of the issues that the articles in this issue address. I was just going to highlight a couple of the themes that come out in the articles in the exchange, and one of them, which is mentioned in the review, and I think possibly John mentioned it earlier, I think he will when he has a chance, is the fact that this is really an urban crisis. The war is even taking place in cities. And most of the refugees, I think the figure is 80%, 75 to 80% of refugees are living in urban areas. The same in Syria, as people are being displaced within and into and outside of urban areas, but also within those urban contexts to different areas. Communities are being placed in close proximity with those that they might not know or have familiarity with. And, the difficulties of operating in those areas for all agencies, I think, are huge. And we're still learning about how to do good work in urban contexts, but this is something perhaps that we need to focus even more on, and I think the Syria crisis really highlights the need for that. There is some really interesting work going on. I think there's an article in the issue actually by Oxfam, which I'm sure Jane knows more about how they used an EMA, Emergency Market Mapping Assessment, to try to work out ways to help refugees to access water in their operational areas in Jordan. And water is a problem anyway throughout Jordan, but this wasn't to give them preferential access, but to enable them to access, for equitable access alongside the people that they're living near. And I think there are some really innovative approaches that are being tried. But still, there's probably more that we need to do, both within Syria as well as in the areas in the country. MSF, Sandrine Tiller and Sean Healy from MSF wrote an article in the exchange, which suggests that we might be focusing too much on the camp situations, because most refugees aren't living in camps. I mean, we have Zaatari, and it is important to understand how that works and what's being done there. But they actually suggest that Zaatari is running relatively well and there are good services provided, and that agencies have focused actually too much on what could be considered the easy work, because you have a camp set up, you know what you have to do, you know what you have to provide, whereas a disproportionate amount of their resources have gone into that, as opposed to into the areas where most of the refugees are actually living and working. And how do you address that? I mean, what do you do? What are agencies doing? It would be good to hear more maybe from some of you in the audience as well as the other panelists about what are the techniques that agencies are using to try to address this issue. The MSF article suggests that that doing this requires extensive community-based work, including identifying and building up relationships with civil society organizations that are in these areas, both amongst the refugees as well as the host communities or the communities they're living alongside. And that most agencies are aware of this and to some degree are trying to do it. And MSF counts itself as in the list of agencies that are having trouble, sort of shifting their approaches. But shifting that whole aid system, the aid machine, is a very difficult thing to do. And I think that's something else that we need to look at. We're a part of our massive system, which has many advantages. But there are many people and agencies, individuals working outside of that. We often find it very difficult to shift direction when we see that something needs to be changed. And then this issue of local partners, which is mentioned by the review by Annie and also by David. I suppose in the issue of the exchange, also in the event that we held, the roles and the relationships, the roles of these partners and the relationships that international agencies have with their partners was discussed. What roles do the diaspora and individuals and local organizations on the ground have in providing humanitarian assistance, and how effective are they? And as I said earlier, are the amateurs outperforming, those of us who are within the system? And if that's the case, what do we do? What do we need to do about that? Can we provide more support? I mean, in the event that we held, the suggestion was made that really it's an issue of complementarity. We need to have both of those things. And it was suggested that local organizations find it very difficult to scale up what they're doing. But it sounds as if the agencies are also having trouble scaling up the work that they're doing too. So this isn't an issue that's peculiar to local organizations either. So that's another area that I think we need to look at. And finally, I think we need to, or at least some of the authors in the edition of the Exchange suggest that we really need to look at how we're working within Syria itself, those of us who do have people on the ground. These urban contexts, the war in urban areas, the difficulties of access, the bureaucratic hurdles. I think Ben described it as with the lack of security and the bureaucracy as Kafkaesque and Orwellian in equal measure, which I suspect those of you who have actually been there would probably agree with. But what do we do about that? And Francois Grunwald, who wrote a very interesting article about looking at cities who are experiencing war, said that he feels that humanitarian agencies have to be more agile, flexible, more opportunistic, and risk-taking. And the classic operational modalities that we have, our humanitarian system, if you like, just isn't going to meet those needs. We have to look at different ways of working in these volatile and complex urban contexts, and possibly reorienting our priorities. Are some of the things that we check off the list in these reviews and evaluations really the most important things in this type of context? And so we need to look at that. And we also need the capacity to engage in strategic dialogue, which is rooted in the humanitarian principles that David highlighted, but with a wide range of actors. If we're working in these volatile and urban contexts, we're working with municipalities. We're working with a stunning array of political and religious factions and their associated militias. With the government, negotiating access, negotiating anything with that range of actors requires, a skill set, which I wonder, how any of us have those really. So we need to be able to look at that. But I think I'm going to stop there, and I'd urge you to read the magazine and watch the video of the event, and I'm looking forward to the discussion. Thanks.
Wendy, thank you very much. They're all very useful and interesting themes to highlight there. And one of them was about flexible and agile NGOs, which leads me to our third panellist from Oxfam, Jane. So how does Oxfam view this conflict?